Every other week, we'll bring you insightful interviews with some of the brightest minds across the data community. We're going to cover hot topics such as AI, ML, Gen AI, enterprise data and analytics, and various data workloads and use cases, including things like data culture, a lot of other areas also. Today, I'm really pleased to be joined by Erin Rebholz. She is President of Merilytic Health. They're a pharmacy analytics consulting and technology company. Prior to Merilytic, she spent 15 years at McKesson. She was in corporate strategy and analytics service for McKesson's distribution business, and then business development, innovation, and data strategy for McKesson's pharmacy technology business. Erin has an MBA from the Wharton School at UPenn and a degree in chemical engineering from Brown. She's currently pursuing a master's degree in data science through Harvard University's Extension School. Erin, it's great to have you. Welcome into the show today.
Well, thanks, Kelly. It's fun to be here. I appreciate the invitation.
Absolutely. I am really excited to have you on the program, dive into your experience and perspective on healthcare. Before we get going, though, why don't you talk a little bit about Merilytic Health and what you're doing right now?
Yeah. So, you mentioned that I'm going back to school for a data science master's degree. And part of that is just trying to imagine the possibilities for how advanced analytics tools can be applied to the pharmacy and healthcare industries. So, as I think about Merilytic Health, it's my own personal consulting firm. It's technology development. I've been excited about some of the work that I've been doing from a research standpoint, as well as broader perspectives from the industry as I, meet up with folks like you.
Well, there's so much value, too, with that experience in healthcare going back a number of years that you can bring to all sizes of firms, I would think, to help them take more advantage, take better advantage of their data, do things around all different types of data workloads in a way that is more valuable for the organization. So in that vein, and when you look at where you and I first met, too, we were really going down this path of modern data and analytics, kind of a modern data stack. What do you feel like is essential today when you think about doing a modern approach for data and analytics?
There's no one size fits all. With some of our more data as a service, self-service models, cloud-based offerings, there's more ability to make small investments and really experiment and develop smaller applications in a cost-effective way so that even small and medium-sized companies can now adopt some of the best analytics tools. So I think we're in a really great era for analytics tools right now.
I just remember so many people that I talked to say, hey, help me get to self-service. I mean, that can be a really tough target. It can be an elusive target to hit. And I'd be interested to hear your perspective on that. How close are we with the tools, the approaches, the technologies, and the people and skill sets to really being able to achieve self-service today?
I think there's two things. One, from a data standpoint and being able to, access the data with cloud-based data warehouses, there's a lot more flexibility to access that data from any analytics tool that you'd like to. So I think maybe data self-service is different than analytics self-service. And the data self-service side, I think that, cloud-based data warehouses definitely enable that. But I think one of the other topics was probably top of mind is governance. And so helping people within your organization understand what that data is also important as well. You have to invest in the areas that are going to be most meaningful to your business.
Yeah, I agree. I'm interested too in the current work that you're doing at Harvard around some of this additional study. How much flexibility is there in the tool sets that you're using, you're looking at, you're working through as you're studying? Is it, hey, here's the one tool that does it all, or is it more this, hey, I can bring my own tool to the game to develop these different data science or AI ML type outcomes?
It's interesting coming at it from a student perspective versus an executive perspective is very different. So from a student perspective, we're learning algorithms that can be generated and practicing on data sets that may not be as sort of robust as some of the executive level data sets, right? So from a student level perspective, it's much more important to understand the algorithm and potential applications of the algorithm. Whereas from an executive standpoint, it's thinking about what's that right architecture to scale applications. So it's a little bit of a different mindset. And so that's actually, as I'm coming at it from an executive perspective, I think about how do you really scale this more meaningfully. And I think that at least with this program, there definitely are classes that are just being introduced about scaling AI applications, because they're realizing that that's a skill that people need to adopt as well.
If I'm a small or medium-sized organization, I may not have all the skill sets or these specialized skill sets available, all the, tools in the bag necessarily, but can I bring existing skill sets to the table that are going to allow me to get something done, kind of, achieve something relatively quickly without a massive investment, kind of grow from there. And I think that, the cloud today, are you seeing that versus even say 5 years ago, more approachability, more accessibility, regardless of the organization size?
Yeah. And if you look at the core tools that are offered through cloud providers, they're much more robust. They aren't as robust as some enterprise scale tools. So if you want to do, just ETL and sort of grab files and load it to your database within cloud, you could do that. But if you need to do that on an ongoing basis, you're managing multiple jobs, you still need to invest in certain tools. But those tools are available within your cloud environment. You can easily sort of run them up. It's a cost-based model, not like a license where you need to have a server. So I think that process is much more robust now than it was 5 years ago. There's definitely a lot of strides being made across the cloud providers.
Yeah, agree. What are the top, let's say, tech trends that you're seeing right now? You've got your eye on. Maybe there are things that you're talking about with colleagues or other folks at Harvard or at Merilytic right now.
One is, and I think we spoke about this, AI, ML, and workloads, and adopting the right tools for your business, and figuring out how do you really sort of manage adoption of some of these, sort of advanced analytic tools and protect the confidentiality of your data, right? And I think that those are definitely top of mind in both places. The other thing for me in particular excites me is just data interoperability within healthcare right now. And I've been doing a lot of deeper dives to look at, especially within pharmacy, as well as pharmacy within the provider community. There's a lot more broader access to data. There's a common framework for getting access to the data across covered entities. And so how do we really connect across our healthcare delivery networks in a more meaningful way? I think, that's definitely a place where I think it's very exciting.
It is. I mean, access and interoperability to me in healthcare, those are two huge issues. How far have we come?
I do think we've come a long way, and I think that we have a ways to go. One of the things, just as, within our national government, they're establishing more of a framework for data exchange, through TEFCA, and having a sort of a common framework for accessing data and sort of regulation around that. It was interesting, I was speaking to someone that's, familiar with the European market, and they're, somewhat taken aback by all this talk about interconnectivity, because for them, that just happens through the government, and you don't need to have various stakeholders to organize and define some of those frameworks. Some of the academic institutions may have adopted more than some of the, regional areas. Pharmacy in particular, I was just at a conference held by the NCPDP, and, they're just this year being asked to opine on how do you bring pharmacy data into that framework. So I definitely think that there are a lot of opportunities in terms of better connecting our data. And, that helps the clinical outcomes for patients as well. So, your pharmacists don't have to call the provider. They can get access to the data that they need. I was at a exchange of information around the Boston area with various medical centers, and, just exchanging charts, exchanging imaging data. How do you do that in order to really improve your patient care? That's definitely top of mind within the industry.
Yeah, I mean, it should, like you said, it should be about better clinical outcomes, better patient outcomes. Are there certain groups, organizations, areas within healthcare that you feel like are doing a better job of kind of pushing this interoperability?
Sure. So there's been recent federal legislation that established QHINs, which are ways that, regional areas or groups within the federal government, they're actually commercial entities. that can exchange information between healthcare entities for clinical purposes, and in the future for patient purposes. And then, longer term, it may be for other things like treatment or operations or payment, but they focus primarily on treatment and clinical applications first. And so, that piggybacks on some of the EHR-based efforts and industry efforts, but then the federal government, sort of joined and built upon that and created better accountability across the organization. So I think the reasons why people are doing it, though, is just around patient care and better access to information, so that one provider who may be not part of your EHR system, or even a health system may have multiple EHR systems, they want to combine them across their EHR systems. So I think it enables sort of better access to information across the ecosystem. And then I think the next phase will be patient access to the information. So some of that has already been in place, just as we think about HIEs or health information exchanges that have formed commercially or in local regions.
Interesting. Are there areas that maybe as an industry, whether on the tech side or the healthcare side, we have not valued as much that we should place more value on going forward?
I think the two things that I think you need to be focused on are, one, around data governance and sort of better cataloging your data, curating your data, tagging your data, enabling that use of it within your organization. And then the second thing I think is undervalued is cost management, and thinking through how do you really, monitor the use of your teams as you adopt cloud technologies at scale. You do have the ability to keep it running by accident, or scale up a server in a way that, you didn't know that was happening. So I think you need to keep on top of things very actively. And I think a number of the cloud-based data warehousing tools are developing more monitoring tools. But I think that that's something, just as an executive leader, it's important to make sure that you're developing.
For data governance and cost management optimization, do you feel like it's more effective being done centrally, or should some of that be pushed down to, a business unit? You were on the pharmacy side, or, which way is more effective, at the business unit level or more centralized?
I think the data governance might have a different answer than the cost side. On the data governance side, I do think central investment, so that, what happens in large organizations is that you develop these data silos. And so how do you really create something across your organization so that people realize what you have, so that you don't recreate it across your organization? And then also incent people to use it, right? To make sure that it's kept up for those high value data sets. On the cost side, I think it does have to do at the business level and the cost center level, because, that's really who's paying the bills. And so I think that there's the incentive to, do something about the information, right? So if you're running up your own bill, there's an incentive to dedicate some time in order to make sure that you're not going over your costs and your budget.
You mentioned data silos in healthcare, that we are seeing improvements in that area. Any comments on that? I mean, how prolific is that challenge?
I think there are a couple things that are interesting within healthcare. One, just for everyone's information, you have a contractual obligation to your patient in order to keep their information private. And people within healthcare take that very seriously. That said, there are ways within HIPAA, which governs disclosures of personal health information. There's ways of de-identifying that data. There's ways of making sure that people have the right use of that data for treatment, payment, or operations. And I think that, there's now sort of regulatory frameworks to examine there. There's also interesting, information where people are taking models and pushing some of the model load down to the specific user provider, and you just return an answer, right? Federated analytics is something that's being examined in a number of different technology providers within the healthcare space, so that, the entity that is the covered entity for the patient information doesn't always have to disclose or give away the PHI. They can actually give away the answer or disclose the answer.
Well, you mentioned PHI. I mean, there's a whole nother level of security and governance when you're talking about personal information in the context of healthcare that we've got to be mindful of and very aware of as we're dealing with all these data sets.
Yeah. And I think people within the healthcare industry take that seriously. And, actually, some of the movement to the cloud recently has been because there have been privacy incidents within health systems or healthcare providers that were managing their own data centers and, maybe not keeping abreast. And I think people are realizing some of the larger scale cloud providers have made great inroads in terms of their own protections. Obviously, you have to elect in those frameworks as you adopt the cloud as well. But I think that there is a lot of movement towards the cloud operators at this point because of that.
Yeah, I'd be interested in your perspective, the balance between risk and innovation. You have requests coming in. You've been leading these data teams. There's, probably way more requests than you can fulfill. How do you balance out that sort of risk innovation profile around each individual request?
I do think part of it is making sure that the request is valuable and realize that you will need to go through a review. And so it's important to make sure that there's going to be value from the risk. So you can do a lot to validate a business opportunity before you actually see data. And there's a lot of actually synthetic data is, I think, being adopted for some of those purposes and for those same reasons, because it's easier to, do a light POC with some synthetic data versus, accessing PHI. So it's something that in the healthcare industry is taken very seriously in terms of going through a review process for any data use, and also making sure you're reviewing your customer agreements in order to make sure how you plan to use it aligns up with those customer permissions that you've had. That all said, I do think there's a lot of opportunities around innovation within the space. But there are ways that you need to put some guardrails around it just because of the risks associated with it.
Is synthetic data something that is used quite a bit in healthcare today?
Well, as you think about, right now, as you do your setup for any analytics, oftentimes you have production or dev and testing. You often don't have real data until you get into some of the testing so that, you're mitigating any risk associated with live PHI. And part of that is, the way that it's used right now is to create better synthetic data in that development phase. Especially around analytics, you need to have a data set that actually is meaningful. And so I do think that data is getting better and better. And I do think it's a good first pass for some analytics in order to sort of figure out if an algorithm works. But then you'll have to go back and validate, obviously.
Yeah. You talked about some of the work you're doing right now, maybe a little bit smaller focused data set. I feel like there's still value that can be gained from a focused contextual data set, especially with some of the new ways that we're approaching AI today with generative AI. What are you finding as you're, running various tests, experiments out there and looking at different ways that AI and ML can be applied in healthcare? Do you feel like it always has to be a large data set, or does a focused contextual data set provide some value as well?
So first of all, generative AI and sort of large language models in general, neural networks really do benefit from a large context of information. You're taking advantage of speech. You're taking advantage of, photos and image data and sound. And, you can use that in order to create and build on top of it. You can actually leverage the data that, the big giants are amassing, right? And you build upon that in creating your own models with transfer learning and sort of adopting some of the large language models. So I think that that's maybe a separate conversation. And I do think that you can, optimize your operating efficiency and think through in a smart way, how do you use some of those tools in order to improve your industry? And I think we'll see a lot of that in the next year or two. Part of that, you look at the operational efficiency and just using those models now, and then, figuring out how to use that for your own segment moving forward, I think is really important. That said, there's also this, reflex in the analytics community that sometimes, simpler models are much more explainable. And so, especially within healthcare, if you're making a diagnosis, how do you take advantage of those larger data contexts, but also make your analytics explainable so that, the practitioner can actually interpret it and sort of help make a decision associated with the patient. So I do think some of the smaller models may be more explainable, and so that there is a focus there. And then the use of some of the neural networks are to help reduce the operating tasks within the industry, within the process. So things like on an image to actually isolate where a tumor may be, but then relying on the radiologist to actually make that interpretation. Or, looking at image data in order to sort of look at size and radiomics associated with the tool, but then also creating a smaller model that can be more interpretable, that actually makes the diagnosis.
Yeah, absolutely. Other areas that LLMs and Gen AI you see impacting healthcare going forward? I know it's early days.
I've been to a number of conferences recently. And one of the things that strikes me is that a lot of your technology companies are actually adopting LLMs, generative AI, and they're putting that in their technology offering. So, as an organization, you're going to purchase technology that's built on these models today. I think each business needs to think about, like, what do we need to develop as a core capability for our operations in order to really focus the adoption of those technologies within your own operations.
Hey, this is a side question. People, process, or technology, which is the toughest? What have you seen as the toughest one over the years to get right?
Process. I think that's the toughest. The people is a hiring thing. Technology, you can definitely, it evolves and you need to be flexible. But process is often undervalued.
Well, too, in healthcare, you've got some really long-lived, very, stable companies that have been around a long, long time, that process and approach is firmly embedded. And I think about having to maybe try to shift that within a large organization can be a huge, huge challenge.
Yeah. Well, even within like smaller companies, you can work more nimbly, but oftentimes the problem is that you need to develop those processes to mature, right?
Well, this has been outstanding. I'd love to just get maybe some more personal perspectives, like your best practices, your learnings. A lot of folks in the data community, I think, would be interested to know, what is your advice if you've got an organization and somebody individually that is looking to modernize their approach to how they do data within their organizations? What is the best piece of advice that you would give them?
I definitely would advise them to look for areas of experimentation. I think that's has been helpful in my career is, take opportunities, even if it's a small investment, to really broaden your team's, sort of perspectives in terms of what's out there. Oftentimes people get used to what they're doing and they're not really looking for the next thing. So it's helpful to use, smaller investments in order to sort of build capabilities within your team so that you don't sort of get people who are sort of very used to or stuck in a specific area. I've also, really valued education for both my team and myself, because I think it's a lot easier to train a person to do something new than to find a person that does exactly what you want to do, especially within technology. And so that's definitely something that I think is important from a leadership perspective as well.
Yeah, I love both of those. I look forward to keeping up with everything that you're doing with Merilytic Health. I'm sure we'll have more conversations in the future. Massive thank you to everybody who listened in today. We appreciate each one of you and highly encourage you to subscribe to the podcast on any of the major platforms, Spotify, Apple, Google, etc. You can find us also on YouTube. We'll see you soon. Thanks a lot.